So if you're asking about pearls or fitting or okay.
Yes. The things that you've learned from your fittings that, you didn't know when you were first cutting your teeth on it, but you learned over time.
So main thing was the diameter, like like we spoke about. We had fixed diameters before, then we altered it, and then we trial fit, and then during the fitting assessment, we decide, like if we
Hmm.
can alter it and how much to alter. We learn that with time. How
Sure.
much alteration can give a good result, right? We
Yeah.
don't really have to wait for the lens to come in and then we check, and then our reorders or refits reduces with time. So
It cuts
that's,
it down, doesn't it? The fitting time down. They
yes,
say
yes.
nowadays that, when you order, empirically that's your trial lens, really, the first lens to learn on.
Yeah.
Yeah. And
I
it's
think
an empirical
empirical
fit.
fit, that's something I have not done from the beginning, and I don't, prefer to
Yeah.
do
Sure.
unless it's like a brand which is not having a trial set, but trial set fit method is the best.
Do you have you sometimes leave those lenses on? I mean, when we were trial fitting with our patients, we would, if you could, a little sneaky, but you leave the lens on for 10 or 20 minutes. First off, they don't know what it's like to put the lens on, so there's a little fear there. But once they get through that and they
True,
settles
true.
down, most kids can tolerate it. But if you leave the lens on for a while, right, what happens? It corrects their vision, right?
Yes, and especially I try to do my fit assessment in the first 5 minutes because, then the over refraction and correction, we have a better idea that way.
Sure.
But within that 20 minutes to say max half an hour, and then we remove the lens, and the kids are like, I can already see a bit clear, you
The
know?
parents are floored, right?
True, true.
They're just like their mouth is wide open and they ask me what this is all about. And I said, well, it's magic. I still think magic is the best way to describe it. I've tried the other ways of describing what we're doing, but magic is
Mhm.
by far worked the best for me.
Especially after the day one, I think parents are more thrilled that way. They're like, the whole day
Yeah.
my child didn't wear the glasses. So they're like,
All right.
very
It's like
happy
it's
about
like
that.
it's a gift. It's like you've entered them into a new
True.
world. A world that they didn't know
Absolutely.
existed,
Absolutely.
and the freedom it offers. Right. I mean, it's like
Absolutely. And it's like
amazing.
we give them a time period, right, for the treatment process. Depending on the refractive error, we tell them, say, it takes a day or two or a week, maybe. And then some kids just get corrected on the very second day and they're so thrilled, especially when they go to school and it's all clear.
I know, right?
Super thrilled about it.
Yeah, it's a life-changing experience, and they tell you that too. I've had
Absolutely.
8-year-olds, right, tell you that. So
The funny part is I've had kids who during the trial process are like crying and running out of the room. And then after a few months or after a year, if I ask them to do a washout, they don't want to stop. They just
you,
don't want to stop the lenses.
If you're interested in getting the rest of the episode, consider becoming a paid supporter of the Myopia Mindset. In addition to an extended version of this episode and every other episode that we do, you'll also get access to exclusive monthly bonus episodes of the Myopia Mindset. And I know you're interested. You've made it this far. You can do so on our Substack, myopiamindset.substack.com. I'll see you at the next one.